I believe having access to care in neighborhoods where there may not be the economic feasibility to see a physician is important for families to live a healthy life. And so I think being in a community health center creates that equity because there is accessible care right in their neighborhood.
Community health centers have been a tremendous asset in all these communities. And also teaches people where their tax money comes from and what you can do with your tax money and how you can lobby for it and how you can fight to bring it back into the town. We're here for anyone that wants to come. And that's the whole theory of the federally qualified health centers. And so I think that's been a great impact on the town.
When I applied and interviewed, the mission of the center really stuck with what I was looking for. They truly had the patient as a whole as their priority. And it wasn't just about numbers and metrics and making money, and it really was about treating people. We can really take the time for the patients and give them the time that they deserve and hopefully the care that they deserve, as opposed to just try to generate more and more revenue and more visits. FQHCs are in that unique position because of that backing from the federal government to not again have such the stress of worrying about that reimbursement from the insurance company, but also then to be placed in a position where we are available and local to our patients and allow them to have easy access to, again, good, hopefully quality care that's just like a private practice or elsewhere.
I actually love the FQHC model. As a federally qualified health center, Stowe Rocks is committed to providing access to care for the most medically vulnerable in our communities. So people without insurance, people who may face barriers to care, whether it's transportation or not having insurance, can come to a health center and receive the care that they need. See a doctor, see a dentist, get those essential services that they need. We have found that individuals that face barriers to care also face inequities as a result. Not being able to see a doctor, not being able to pursue a healthy life with the preventative services that most people can really take for granted. Having community leaders that are part of his board that help to make decisions on what is important for that particular neighborhood to access care is a part of the model. So empowering communities through voices that are at the highest level of decision making is important.
More than half of the board have to utilize the services of the health center, and that really does force it to remain patient-centered, community-focused, because the people that are ruling are the people that are being served on the majority basis.
The people that use the health center and live in the community kind of know the needs of the community. So that's one of the unique things.
In terms of action and advocacy, it really is bringing all people to the table.
The health center is an incredible anchor resource for the Stowe Rocks community, and there are so many far-reaching implications for that. If we think about that ladder to success, right, and if we think of those top rungs at being that they're at a place from an income perspective and from a wealth building perspective where they can provide for their families, where they can have the type of life that they want to have and enjoy that quality of life. Obviously, you can't get to those rungs without good physical and mental health existing there. And this health center has been an absolute core to helping us understand that. As we unravel generational poverty and the trauma that's created through it, to get our residents to be able to step up that ladder, so to speak, we need the health center here to help us think through that physical and mental health wellness piece, because it's absolutely critical to the residents that we're serving.
Quality of care is a core tenet of being a health center, and so we receive federal funds, and along with those federal funds is a commitment to make sure that we're looking at health indicators related to preventative services or chronic disease. making sure that we're connecting patients to the care that they need.
Patient-centered medical home is a model that really does put the patient at the center of their care. That is part of patient-centered medical home. We involve the patient in our decision-making aspects of our care. We engage them in their care. And then we also, though, help provide those extra services that they need. So where the old physician may give you a prescription and send you out, we send you out, but we're going to call you in 2 weeks to see how it's going. It is caring for the person as a whole, and providing health care with a heart really does mean providing the best care that we can in the circumstances that are best suited for that patient.
We've always been very lucky to have a caring staff. You know, when you're surrounded with people that have that same inner fire to do that, it makes a big difference.
And I've seen them do it with a lot of heart, a lot of teamwork to make sure that we make those services available.
Why it's so important for all of our smaller organizations to collaborate is that we all have a piece of the puzzle in what we do, okay? And separately, we can't make that entire puzzle, but together we can. Together, we truly do form a larger body. And if you think about it, when you have the school district and social services like Focus on Renewal and the Zealous Hope Project, the health center, the CDC working together, okay, we're able now to serve the whole needs of our residents.
You can only move as fast as trust. And so establishing trust at the very beginning is essential for the work that we do every day as a health center. Creating more equity to the services that are needed to make sure that those disparities are lessened or eliminated is a part of the everyday work of FQHCs.